is glass skin, does that really exist, and is that truly achievable?
Okay, so glass skin is really a Korean concept. In India, we have thicker skin, oilier skin, terrible weather, high sweat, humidity, pollution. We're already on a back foot. I think that the expectation to have specifically Korean skin might be a bit much. Our skin is a reflection of what's inside and also an evidence of the trauma we're experiencing from outside. Your skin is not supposed to be perfect. You do your actives, you do your treatments, you do your sunblock, and then you take a break. You do a skin fast. Sometimes a break is more restorative. It cannot be constantly on the grind. It's a mix.
Some women have really bad pigmentation after giving birth. Sunscreen is just to prevent tanning.
That's not true. But a tan is a sign of damage. It means that your skin is damaged, so your cells are releasing melanin in response to protect against further damage.
So if you had to give a mom a 3-step non-negotiable skincare routine, what would that be? कभी नोटिस किया है जैसे जैसे हम बड़े होते जाते हैं हमारी स्किन हमारी कहानी बन जाती है. हॉर्मोन्स, स्ट्रेस, प्रेगनेंसी, इवन पेरेंटिंग, सब कुछ स्किन पे दिखने लगता है एंड फॉर वुमेन स्किन कंसर्न्स एक अलग ही चैप्टर खोल देते हैं, खुद के लिए भी और उनके बच्चों के लिए भी. वेलकम टू अनदर एपिसोड ऑफ Maatehood विद प्रियंका रायना. आज मेरे साथ है एक डॉक्टर जिनकी इनसाइट्स आपके लिए गेम चेंजर हो सकते हैं. शी इज़ द फाउंडर ऑफ एसिया एस्थेटिक्स, author of Skin Sense, and one of India's most trusted dermatologists, Dr. Kiran. From adult skincare myths to the science of baby skincare and even the emotional impact our skin has on our confidence, this episode is packed with insights every parent needs. Dr. Kiran, welcome to Maatehood. Such a pleasure having you here today.
Thank you so much. I'm so happy to be here with you.
I know. I've been after you for a long time. Please come on Maatehood. So thank you for taking time out today.
Oh no, I was the one who told you, let's do another thing, remember?
I'm so glad we did it. I mean, we have known each other for like, I don't know how many years, 6-7 years now.
Yeah.
And I have been coming to you regularly for my own skin concerns. So I'm so happy that today we're going to have this conversation and we'll share that knowledge with all our audience because as you know, skincare has become another level of obsession.
It really has.
Yeah.
And we have to really be careful also for the skincare for our kids, which is why I'm so glad to be here.
Thank you. So before we begin, I would love to know about your journey. What really inspired you to get into skincare, dermatology, and aesthetics, everything?
So I would tell you that, so my mom is a doctor, so obviously, and I was born and raised in New York, and I always saw my mom working, and I was always fascinated by whatever skin disease would come.
Yeah.
But I also love beauty, and I always loved skincare. I always loved everything beautiful.
Yeah.
And beautiful can mean, just completely unique beauty. It's not cookie cutter beauty.
Yeah.
So for me, that was lovely. And then having science, because your skin really is a window inside.
Absolutely.
So what I love about dermatology and aesthetics is that, if you're having acne, is there some hormonal issue inside? If you're having a certain kind of rash, could there be stress happening?
Yeah.
So that interrelation between inside and out actually really drives me, and I'm very passionate about it.
Yeah, and I think you're in the best place because it really, as you said, it really drives you, it makes you happy, and we can see that when you're actually helping your patients. When you say beauty, and beauty, of course, there could be several definitions about that, but now I think it has all come down to the glass skin effect. You must be feeling that. So is glass skin, does that really exist, and is that truly achievable?
Okay, so glass skin is really a Korean concept, right?
Yeah.
And it is that iridescent, poreless, dewy skin. Now, interestingly, understand that a lot of people's skin in India is thicker than skin in Korea. So Korean skin is by definition tends to be thinner, so you can get more of that iridescence.
Yeah.
Korean skin has less pores and they make less oil. You'll barely ever see anyone with pimples in Korea. Try going on a subway there. I think I saw one person with acne the whole time I was there.
Yeah.
So they have a naturally easier way to get there. But separately, in Korea, people are very careful with their skincare, with procedures, with dermatology, with plastic surgery, with everything from a very early age. Because aesthetics is very important to people, to my knowledge, at least based on whatever I've read and whatever I've seen, to people in Korea.
Yeah.
So they have 10 jumps ahead, right?
Yeah.
In India, we have thicker skin, oilier skin, terrible weather,
Yeah.
high sweat, humidity, pollution. We're already on a back foot. And we also usually start now later, which is also okay.
Yeah.
I think that the expectation to have specifically Korean skin might be a bit much.
Yeah.
Can we have smoother skin, more even skin, more dewy, more hydrated skin, brighter skin? Absolutely.
Yeah.
Can we all of a sudden turn Korean? No, not really.
Totally agree. And as they say, your skin is the reflection of everything inside out, right? It's about how you slept, what you eat, your hormones, and everything all together. So what do you have to say about that?
So again, our skin is a reflection of what's inside and also an evidence of the trauma we're experiencing from outside. So your weather, your, like I said, pollution, smoke around you, all of that will also impact. Now, again, the expectation of Korean glass skin means that you're also adding an expectation onto your skin. Your skin is not supposed to be perfect.
True.
You're just not supposed to have rashes. Ideally, the rash might mean something. Certain level, certain types of pigmentation, certain skin diseases, certain amount of acne. All of that is actually more disease-oriented, whereas our expectation for our skin has increased over time. The body doesn't need your skin to have no pores. That's just part of growing up.
Yeah.
The body doesn't need your skin to have no lines. That's part of using your face.
Yeah.
It is an external expectation. Now, separately, if you like that external expectation, that's your choice.
Yeah.
But do you need to go there?
Yeah.
I don't think so, nor does your teenager.
Indeed.
I mean, is it mandatory? Absolutely not. That does, if you have perfect, poreless, lineless skin, it does not mean that you're necessarily healthier. It can very much mean that you just worked a lot at it.
Yeah.
It's like a workout. It's like when you go to the gym. Like, you don't need to be like 6% body fat.
Absolutely. I totally agree. But, there are different kinds of sciences when it comes to skincare and hair care, of course. Now there's a whole trend of going to 10 levels of skincare, 10 steps routine. And then you have all these Korean products in the market. So many Indian brands who are doing fantastically well, layering them up and achieving good skin. On the other hand, if we talk about maybe Ayurveda or natural way of treating your skin, they would never talk about putting on anything on your skin, rather focusing on what is inside, really focusing on your diet and on your lifestyle. Till what extent do you think that is true, or should it be a combination of both, or can we achieve good skin by either doing any of these?
I actually believe in using the benefits of old science and the benefits of new science.
Yeah.
So we can actually combine them together and merge them and utilize information from all different sectors of life. We take information from yoga, we take information from Ayurveda, from Chinese healing, from acupuncture, from dermatology, from wellness, from fitness. Draw it all together and make a holistic idea. If you see, for example, I do a lot in wellness and in GLP-1 based weight loss and in non-GLP-1 based weight loss, right? And we have people who plateau. And when they plateau, I don't tell them to eat less or exercise more. I actually tell them to take a break. It's a refeeding day. It's a rest day. And then all of a sudden their plateau is gone. So they eat more, they rest more, and hey, 3 days later, somehow their weight dropped. Same with skin. You do your actives, you do your treatments, you do your sunblock, and then you take a break. You do a skin fast. Okay? You wear sunblock always, but you take a skin fast. And then you take a break. Same thing with treatments. I never tell people just do treatments indefinitely. You do your course, then you take a short break, and then you come back. Sometimes a break is more restorative then. You get the benefit of all the treatments you did for those first 6-8 months. Then maybe you do some light facials in between, you take a rest. And allow that stuff to really fully show the result. Then you come back. It cannot be constantly on the grind. It's a mix.
Talking about actives, there's so many. Niacinamide, kojic acid, azelaic acid, and retinols. It can be very confusing for anybody who's just starting this journey. And I think you have to be very careful with what you're layering with what. So how should one go about it? And in what case should they actually start using actives? Should they or should they not? And if they should, what should be the right approach?
So look, I don't believe in 10 or 12 step skincare. And I talk about it in my book, Skin
Yeah.
Sense. I don't believe in it. I don't think our weather conditions make any sense for it. The amount of humidity you have here, put 12 products on your face, you will be suffocating. No logic. I like 4 steps, maybe 5 steps. If you have different areas you're covering, your under eye, lips, add that on. That's enough.
Yeah.
Actives, honestly, I think this whole DIY, build your own actives, build your own bear kind of thing is a little much. People always come in with a ton of actives, but they're not achieving their objective.
Yeah.
So they still have their pigmentation, they still have their acne, they still have their enlarged pores or their scars. So they're doing something.
Yeah.
So maybe it would be worse otherwise, but the direction is off. So the question is not the actives always, like how many actives. It's more like, what's the problem? People forget that you have to start from the fundamental.
Yeah.
What's the problem? What's the cause? Let's solve that. And after that, we talk about actives. But the problem is never dealt with. You have acne, I'm using salicylic acid. Why is it not going away? Why do you have acne?
Yes.
You have pigmentation. I'm using, kojic acid. Why is it not going away? But hey, are you still coloring your hair, and is that causing your pigmentation? Are you wearing sunblock or not? Are you out in the sun all the time? Do you smoke?
Yeah.
The causes are never addressed, and the fundamental isn't addressed.
Yeah.
Once you get to the base of it, everything else becomes easier.
Since we are talking about routine, what is the most basic fundamental routine that everybody should follow? Because I've seen people who are not even doing the basics, like a night routine or a morning routine. What is it that everyone must follow and should not be skipping?
So you must wear a topical antioxidant no matter what. Understand you're in India, tough UV rays, our ozone is weaker, we are reflecting UV left, right, and center, our visible lights are problematic. Your sunblock is key, and your antioxidant is key. So topical antioxidant includes vitamin C. If you are sensitive to vitamin C, which some people are, we change it to a resveratrol product, okay, or fullerene if you can get fullerene. It's a really interesting antioxidant. And then you wear your moisturizer if you're not oily. If you're oily, you can drop it. And then you wear your sunblock.
Yeah.
Sunblock, topical antioxidant in the morning, absolute. At night, now we look at what age you are and what your concerns are. All right? You're older, maybe you want to look at your retinols. Maybe retinols don't suit you. Maybe you want to look at alpha hydroxy acids. You definitely want peptides. I mean, this is fine. Pigmentation, we look at anti-pigmentation actives, your alpha-arbutin, your kojic, these things are really great. Tranexamic if you have melasma. Do that, and again, something to boost the skin. So a peptide or a copper peptide for renewal.
Yeah.
When you're young, a good moisturization at night is honestly a lot. Enjoy your youth.
Of course. Wish could go back there.
I know, exactly. Enjoy it.
Yeah. There's one star ingredient which I've seen pretty much in every product, which is the niacinamide.
I knew you were going to talk about that.
And I see that usually it's very easy to layer it up or even combine it with other actives. Tell me more about that, and what are the things you need to be careful with?
So niacinamide is not one of my fundamental ingredients, but it's a great adjunct, So if you're oily, niacinamide is great. If you're acne prone, niacinamide is great. If you have enlarged pores, niacinamide is great. Other than that, for pigmentation, it has very minor benefit. But niacinamide is pretty inert. It's a type of vitamin B. And you can use it with your moisturizer before your moisturizer. So it suits almost everybody.
Yeah.
Is it offering you utility or not is the question. It feels nice, hey, I'm doing niacinamide, but are you getting a benefit from it?
Yeah.
I don't like doing anything that doesn't give you a benefit. Just for the sake of it, it makes no sense.
Yeah. But what are the benefits we can expect from that?
Oil reduction,
Yeah.
some mild benefit in acne, some decent benefit in pore reduction, and a hint of benefit in pigmentation.
Yeah. I think what is also important is to look at the concentration, because some products might be using it at 2%, 3%, 5%. Is that effective enough? And till what extent you should be increasing it?
Minimum 5% of niacinamide is needed. Between 5 and 10% works.
Yeah.
Understand that the company will say, hey, we're 10% niacinamide, but they're talking about the whole extract, the whole active, and of that 10%, it might be only 1% of niacinamide.
Yeah.
So sometimes companies brand very well, but it may not actually have activity. So say you're using a 10% niacinamide serum, but you're not getting a result, maybe switch the brand, because maybe that brand is just marketing it, but it's really like 95% water and 5% of that 10% is niacinamide, which puts it at 0.5%.
Yeah.
Do you understand?
Yeah. Yeah.
I don't know if I'm explaining that right.
No, absolutely. Another one, I think another ingredient everybody has to be extra careful with is the retinols, but also getting very popular. Tell me more about that.
So retinols are really great actives. They're data proven. Now, understand for me, everything goes back to data, and that's how we were trained in the US. Evidence-based medicine.
Yeah.
Retinol increases your collagen and your skin thickness by up to 44% over 6 months. Certain retinols, topical tretinoin has the strongest basis. Retinol also has great basis. Then we have a bunch of other different options. Retinol is the gentlest, or retinol is the Retinol palmitate is the gentlest. It will do nothing for you. It's really preservative. We have retinol. We have retinaldehyde.
Yeah.
Retinal. Then we go into the retinoids, where we talk about adapalene, tretinoin, tazorotene, trifarotene.
Yeah.
So you start with retinol because retinol palmitate has a minor benefit you can try, but really if you have good resilience, you can start with retinol and then you build up over time.
Yeah.
It's great for fine lines, great for skin texture. People that are on topical retinoids for extended periods of time, you can see it. They have a nice shine to their skin looks healthier, it looks more towards that glass skin, it looks smoother. I can always tell you a person who's using regular topical retinoids just by looking at them.
Am I?
No.
I just started.
I don't know. Has to be at least
I have to ask you maybe like how frequently I have to start using
tell me in a year and you should be using it properly.
I'm going to ask you for the tips. I actually recently started my journey with all these actives and this and that just to, see what difference does it make to my skin, because I told you I'm having a lot of acne and that has become a pain point for me. So I want to dive deeper into acne. But before that, when we talk about starting to use all these actives and ingredients, how would you segment it in terms of age? What is the right age to use what?
So here's the thing. When it comes to young skin, so you're 20, 18 and above, a good topical vitamin C, a good moisturizer, a good sunblock, you're pretty good. Okay? If you have concerns, we'll deal with that separately. But if we just have good skin, this is really good.
Yeah.
Then we're hitting around 28 and above, 29, we start looking at retinols.
Yeah.
Then once we're in our mid-30s, we start trying to push up to the topical retinoids.
Yeah.
In our 40s, we look at those peptides. And we look at firming serums more in our 50s.
Okay.
In our 50s also, I start looking more at oils. Because once we hit menopause and perimenopause, we have less estrogen, we create less moisture, and we're drier. So I look at more regenerative things and more nourishing products.
I would like to talk more about the prenatal and the postnatal phase, especially moms who have just given birth. And that's one of the, I think, a phase which really takes a toll on your skin, hair fall, acne, pigmentation, so many issues a new mother can go through. What would be the most gentle and effective ways you think that they can deal with?
So understand that pregnancy and breastfeeding and then stopping all of those things are a huge hormonal change for a woman.
Yeah.
So when you're pregnant, most women actually have, more hair growth because their hair transitions into anagen cycle, so the growth phase.
Yeah.
Then obviously, you deliver and you go into breastfeeding and that joy goes away. You lose some hair, very normal. Also deeply vitamin deficient. You've just delivered a child that has eaten up all of your internal nutrition.
Yes.
So good vitamin supplementation. We do specific vitamins we check for, and we have higher level requirements than what the lab does.
Yeah.
Then we go into skin. Now, a lot of women feel more glowy during pregnancy. Some women feel worse.
Yes.
Some women get acne, they're duller. I believe that has a lot to do with how much progesterone you have or what the balance is between estrogen and progesterone, maybe testosterone. There's so many different hormones. I'm really simplifying it.
Yeah.
There's certain skincare we give for patients that are having these issues, that are safe during pregnancy. Like you can use topical vitamin C, you can use alpha hydroxys like glycolic acid derived from sugar, lactic acid derived from milk.
Yeah.
You can use certain antibiotic creams that are allowed in pregnancy, certain products. But obviously we can't use everything. So we really watch and decide what we do for pregnant patients.
Yeah.
And we prescribe accordingly for that time period. Because in our mind, the child matters the most.
Of course.
And this will all settle.
Yeah.
So we balance the need of the mother, but we also balance the fact that there's a child growing.
Absolutely.
Right?
Yeah.
So we do that, and then once you deliver, again, things change. So then we can do, then we can do a lot more because you're just breastfeeding and very few things enter into breast milk. So topically we can do a lot. We just watch out what we give you orally. You know, so we might avoid the oral medicines.
Yeah.
Many of them, some we can manage. If you have very bad acne, for example, we have more actives we can use. Like we can use our topical retinoids, but we don't put it on our child. So we can do stronger actives when you're breastfeeding.
Yeah.
Because they don't enter into breast milk.
Okay, amazing, good to know. But what do you think is the reason that some women have really bad pigmentation after giving birth?
So if you're talking about melasma, melasma is a specific kind of pigmentation that happens during hormonal change.
Yeah.
Say you take an oral contraceptive or a hormone pill or Plan B, some people get triggered with melasma there.
Yeah.
We have to take out the hormonal contraceptive then. If we can. If we can't, then we somehow have to treat through it. Some people get it when they're pregnant. 30% or 40% of the time, I can't remember which one it is, please forgive me. Once you deliver, that pigmentation improves.
Yes.
So that's great. So sometimes we wait it out and we do some actives. Sometimes this happens during menopause. Usually it's hormonal change. Okay. Sometimes it happens without hormonal change, but there is something underlying happening. We have yet to identify which particular hormones in combination are the cause, so we can't do a blood test. Okay. It is a clinical diagnosis.
Yeah.
So like I said, melasma, hormones. A lot of people get it.
So the simplest way to deal with it would be to actually find the underlying issue, what exactly is causing it, then go on to the treatment.
So the thing is with melasma, for example, if you're on a hormonal contraceptive or you're taking hormones, many women are on progesterone.
Yeah.
You know, once that comes off, a lot of that changes. So that's remove the inciting factor. I also tend to avoid anything that worsens hormonal irregulation. So perhaps dairy, soy-based products, that also makes a difference. Anything that increases IGF-1, high glycemic foods, processed foods, remove that because that'll operate and trigger the hormonal cascade. That's what I do there. And sunblock. A lot of people don't wear sunblock. What do I tell you? Please wear sunblock. It's okay.
I'm going to come to that.
Okay.
Shortly.
And that. I mean, so this is holistic, clean, easy things you can do without stress, without even needing a doctor.
Yeah.
Right? Except for the hormones, which you will do with the doctor.
Yeah. But since in prenatal phase, we are limited to what we are using for our skin. And then after birth, we want to get on that journey of skincare again. So how do you suggest that new moms should get on with their skincare routine? What are the simplest things they can do? And then, of course, increase their steps and more actives in their routine.
See, honestly, new moms have a host of conditions. They might be drier. They might be oilier. Their pores might be bothering them. They might be super saggy. Pigmentation, acne, there's so many concerns. It's very hard for me to say, hey, this is definitely what you should do because there's so many different moms and so many different skin, so many different issues. It's human. Each person is different.
Yes.
I would say at the very least, start your cleansing, start your vitamin C, start your sunblock, your moisturizer, at the very least. If you're acne prone, don't do the vitamin C. Any other concern, just go to a doctor because at the end of the day, we know exactly where to treat and what to treat. And we know what's safe and what's not safe. And when it comes to breastfeeding and pregnancy, there is a lot of micro information that we may have and we can understand and translate to you.
Yeah, absolutely. Now coming to hair fall, another very big issue for new moms, you know, losing all that hair can be very overwhelming. It can be very stressful.
Oh yeah.
Do they actually just come back without doing anything?
Some do, some don't.
Yeah.
So some definitely do. Some of them, that hair falls and then it comes right back. I get the sub-selection of patients that obviously it doesn't because that's why they're coming to me, right?
Yeah. I've been one of those.
There we have lots of options. Again, it's vitamins, supplementation of proper vitamins. I've talked to you about that before, right? We do good proper shampoos, nothing too harsh. Less hair styling, those hair Botoxes that people get, the straightening one, the hair perms, the keratin straightening, the Brazilian blowouts, all of that can cause significant hair fall. So we avoid as much styling as possible. Yeah. You're just traumatizing your hair. Of course, your hair will fall. We do LED. LED has great data for hair growth.
Okay.
So those LED hats or helmets, they're actually quite effective.
Yeah.
You can get up to 22% more hair growth over 12 weeks.
And you can use it just on your own?
You can use it on your own. You can just buy one. Different helmets or hats have different protocols, so you just follow the directions. It's really nice, really safe, really hard to go wrong. I like home devices more and more for things that are now manageable, because the devices themselves have cutoffs, so they don't usually allow problems unless you have an incorrect device or you're just not suiting it.
No, indeed. And now there's so much innovation, so why not?
Exactly.
There's so many options
joy
available.
of science. And I was doing LED, honestly. When I moved to India and I moved to Delhi, I was offering LED from the get-go. Like, I found it so fascinating, photobiomodulation, that blue light can kill acne. I just had a patient come in the other day who was telling me, I came to you, so long ago, more than a decade ago, and you made me do blue light, right?
Yeah.
And I was the only person doing it, but I reduced her acne just with 3 sessions a week of blue light. Okay. And I had added LED red light then too. I mean, I have believed in photobiomodulation for more than a decade. Now it's such a craze, but it's been around for a long time.
Absolutely. And talking about that, now there's so many tools available even for your facial skin. So what's the difference between the red light therapy and the blue light therapy? Both are getting very popular. How to differentiate?
So red light is 630 nanometers. It is actually between 630 and 670 nanometers. It is shown to improve wound healing, improve muscle recovery, improve collagen boosting, glow. I mean, red light has great data for the skin and great data also for hair, because it actually creates ATP in hair follicles. So ATP is energy. It's the energy biomarker. So you get more ATP, so your hair follicles have more energy to grow.
Yeah.
So that's what it does in the scalp, and in the skin, I already told you, it boosts collagen, improves blood flow, and helps in recovery.
Good to know that. And there's so many more tools in the market which are getting very popular for your facial skin, especially. Yeah. Which one is your favorite?
So I actually really love blue light for acne. It's one of the things I've been doing for more than a decade. That is in the 400 nanometer range. It actually kills acne bacteria. You do it 3 times a week, and you actually see a benefit of killing acne. It's wonderful for acne-prone people. I love that. I love microcurrent devices. I really believe we're doing very little to tone our facial muscles, and face yoga is too variable, it takes too long, and you can mess with the wrong muscles. So microcurrent is specific. You boost muscle tone. It's gentle. Will you see a huge difference? No. But will you be improving your muscle tone over time? Absolutely. It's like a workout. Yeah. Here we have a great device called V-Face, which is much more hyper-powered. Yeah. Patients see a huge benefit with that. And then we tell them, you come here for maintenance, but also at home you can do microcurrent. Yeah. Another thing I love is home radio frequency devices. They're great, also help with boosting collagen. You can do them at home. You still need treatments to get strong result. Yeah. But whatever you can do at home, if you have time, do it. If you don't have time, honestly, stick with a good LED mask.
Yeah. Talking about collagen, and we have spoken about it a lot, I think, till now. What are the signs and symptoms where you can actually recognize that your skin is now losing collagen and it's time to boost it up through some external factors?
So I would do something called the pinch test. Okay. So it's called a recoil test, right? So pinch your cheek, Priyanka. All right. Now, how fast does it go back to normal? Right? So mine goes back really fast. Okay, so I have good collagen, good elasticity, but I have been doing lots of stuff to myself for a pretty long time, so I better have some good elasticity. So as your recoil reduces, and you track it over time, Indian skin sometimes has better recoil than non-Indian skin, but you will see over time it change. As the recoil reduces, your collagen is going down. That's one of the easiest things you can track yourself.
All right, and what are the best ways to boost it?
Collagen supplements are wonderful. No, you will not see a benefit in a week. You have to do it at least a year. Okay. At least 3 grams of collagen a day. Anything less than that is a waste of your time. Okay? And not the vegan collagen unless you're really desperate. The best collagen is non-vegan. Okay. Of course, if you're vegan and you have no other option, there are options out there. They're just not as good as the non-vegetarian.
I have heard about marine collagen as well.
Marine is great. The marine is a great option. So marine has great data. It's great for wound healing, joints. People who have joint issues, collagen is wonderful. Yeah. Great for skin, great for hair, great for nails. Collagen is the building block of nearly everything in your body. So supplementing it is great. Even helps with gut health.
Ideally, at what age do you see the need of using it?
Anytime where you're feeling, I would say honestly above 40, but below 40, if you feel like you're sagging, some people just don't have very good reserve. You know, women, sometimes they're low on estrogen. Many of them have early menopause. There's so many women that are really suffering with hormonal dysregulation. For them, start collagen early. You're finding lower recoil, you're seeing more sagging. Women who've had a lot of babies, stretch, recoil, stretch, recoil. You know, there's so much of that. Collagen is great for them too.
Amazing. Now, coming to acne is one of the biggest pain points I feel for women and children as well. Now, if you're getting acne, there's a whole analysis of which part of your face you're getting acne on, and that tells you what could be the root cause of it, what is causing the acne. Is that really true?
Some of it is true. It's not like guaranteed, okay? I will tell you, if you have more acne on your forehead, I always think either A, hormones, or B, dandruff.
Okay.
But then it could also be you're threading wrong. Somewhere your threading person gave you an infection.
Could be. You know, but that would be like for a short period of time, right?
Yeah, but sometimes it lasts, you know, because it's not treated. Jawline, usually hormonal, but could have been, you know, after you shaved. So you have to look at a few things. Like you can't just assume, okay, I face mapped and now I know all the answers. I love deep dive. I want a deep dive. Every patient that asks me a question, sometimes they send me a WhatsApp. They're like, I have these bumps. And I will ask 17 questions, okay? And and then I want to know why it happened, because only then can I give real treatment. Which is why, honestly, WhatsApp is so hard, because like if you really want to know why something's happening and solve it, like it takes time and, you know, it takes effort. So I had a few people that just started shaving all of a sudden and didn't mention it. Like, I have these bumps and my acne is getting worse. And had I left it at that, had I said, okay, your acne is getting worse and given them acne treatment, it wouldn't have gone away, because the treatment's different. Once I asked those 7 questions, 10 questions, and got to the bottom of the fact that they just started shaving or been dry shaving or did some things, I understood I had to treat something called folliculitis instead of acne. And it was gone. You really need to know why something's happening.
True.
And people who have a lot of hair here will shave here also. So you'll miss it up. You'll mix it up.
So it started happening with me. I started getting a lot of acne on my, how do you call it?
Jawline.
On my jawline. And it's like these acnes which are big, painful, and sometimes there's even pus in it. So usually it is because of hormones, right?
Yes, it can be, but sometimes people also, for example, they have dirty pillows, they sleep on one side, they take their phone, their dirty phones, and touch it to their face. Right? We call that acne occlusiva.
I think that you can identify from like how frequently do you use it on your left side.
You'll see the left side is way worse. All of a sudden, one side will be way worse than the other, and I'll be like, A lot of people also touch their face a lot. They're always like touching themselves.
But there was a phase, like, you know, I did not have any acne. And then all of a sudden, in my late 30s, the acne started to come back.
That can easily be. So 30% of adult onset acne is hormonally related.
What is the best way to deal with hormonal acne?
It is so much care. There's like usually topical retinoids, topical antibiotics, sometimes benzoyl peroxide. It depends on how severe they are. Once they hit grade 3, grade 4, we start looking at oral medications. But we have to identify what grade they are. So, I mean, I go by protocols, grade 1, grade 2, grade 3, grade 4, and we establish what grade you are. And then based on what will suit you, we choose our medication regimen.
True.
And if people want to avoid oral medication, we do offer treatments that really help. Like we have a great peel called BioRejuve here. Really helps with acne. We add blue light to it. There's certain other lasers. Wonderful. But I can also treat your acne with medicine. So unless you have a wedding in like 3 weeks and you need me to get rid of it fast, like why not do the medicine? It's cheaper for you. But a lot of people are also averse to oral medicines. So then we have other options.
So when we say hormonal acne, is it really like in your body the hormones have gone completely haywire, or it's just that with age your hormones are now produced differently?
It can be either. Usually if you're getting more acne, we consider testosterone pathway or insulin resistant pathway, which ultimately translates to testosterone. We look at that usually. Sometimes people that are estrogen dominant, they get that 1 or 2 PMS pimple. That also happens. We look at a bunch of those things, but usually it's more in the testosterone insulin resistant pathway.
All right. Now coming to scars.
Okay.
I think one of the most difficult thing to deal with, right? And I don't think that you can handle scars with any topical treatments. So what would be the right way to actually recover from those?
So there are atrophic scars, right? So there's either ice pick, which are really small, really deep. There are rolling, which roll lower. And there's box scar, which are square.
Yeah.
Then there's deeper tethering that causes sometimes linear deformities. That's separate. We grade each scar. One is the type of scar. Next is the grade of the scar. Grade 1 is, you can barely see it. Grade 2 is you can see it from, a certain distance. Grade 3 is, you can see it from an X distance, can't even cover it with makeup. Grade 4 goes also, if you stretch it, it doesn't even stretch out, and you can see it no matter what you do, right? So there's different grades of scars as well. Based on the grade, we treat. Now, creams, the only thing that has been shown to help is a little bit of topical retinoids and silicone scar gels and pads to moisturize the scar.
Okay.
It helps by up to 10 to 15%.
Yeah.
Something you can do at home. Will it make it go away? Hell no.
Yeah.
Right?
Thought so.
Yeah, so there's a lot of stuff we do. We do lasers, we do laser resurfacing, we do microneedle RF. Plain microneedling people are all obsessed with, but it doesn't have that much efficacy quickly for scars. It takes a lot longer than the other devices I'm mentioning.
Yeah.
We can do subcision. We can do things like TCA cross, which are peels, but huge downtime. Then we also do things like boosters. Boosters have beautiful benefits. They also help heal the skin, increase collagen, increase elastin, make your skin healthier. And at the same time, we improve the scars.
Yeah.
So people that are in a rush, like all my brides, or I have a lot of people that fly into me from the US or Europe. They have maybe like a week.
Yeah.
In and out, we do boosters and send them home, and they're really happy.
And within a week, you can get rid of these?
You can improve it a lot in one session. Usually they do have to come for follow-up.
Yeah.
And then we wait and see how long it lasts. Some people last years.
Oh,
It's quite nice.
And they do come back?
They can come back, but very often not all of it comes back because we have subsidized and improved the scarring.
Yeah.
At the same time, we've hydrated and healed it. So you do get a natural collagen benefit right there.
Yeah.
So we have some long-term improvement. And even in that short 1 week, we get quite a big result.
And how can you avoid having the new scars?
So you gotta treat your acne early. A lot of parents, they're like, oh, my kid has acne, let it be, it'll heal on its own. The problem is not the acne. Acne, yes, will go away over some time, over years, sometimes 6 months, sometimes 10 years, but it can go away if your hormones balance. The problem is not the acne as much as the scars. Because the longer acne is there, the more inflamed it is, the more likely you are to have scars, and scars are hard to treat.
So it's not just like if you're picking your acne, you're going to get a scars, but there could be other issues.
Yeah, I mean, if you pick your acne, of course you'll get scars, but separately, the inflammation of the acne will cause scars. And acne can go away, but scars can't.
No. True. So when we talk about anti-aging treatments, I think one of the very important concerns one might have in their 20s, 30s, or 40s, what would you suggest what is the right treatment to go for?
Oh, microneedling by all means. You can get up to 400% increase in collagen with regular microneedling sessions.
And you can start that in your 20s?
You can start that in your 20s. You start really gentle.
Yeah.
I also like gentle peels, more for surface damage in your 20s. And nice, just removing of damage, like hydrofacials and light oxygen facials. That's great in your 20s. Yeah. But microneedling is one of the best things to start at any, age, even in your 20s, because it really does build collagen, and especially if you do it in a specific way. So there's a specific way we do it here. We call it good genes that boosts baby collagen. So it actually regenerates. There's a regenerative method of microneedling that we believe in that you can start at any time, and you actually see your skin get better and better over time. I have patients that have been with me for so long, and they look better now than they did 10 years ago.
And how frequently should you do it?
Once a month, once every 2 months, take a break in between.
Yeah.
But keep doing something
Be more
that.
regular with it and consistent. Okay, now coming to the Botox and the fillers. Getting very popular. Question number 1, should one go for it? And if so, how frequently, at what age, what is the right way of approaching this?
So Botox and fillers is not mandatory.
Yeah.
I want to make it very clear. Aesthetics is a choice. It is not a compulsion or requirement.
Yeah.
You don't like your lines, do your Botox. You don't like your under eye hollow, or you want your lips a little plumper, do your filler. It's fine. If you don't care, don't do it. If you don't want to do Botox and fillers, there are other things we do. We do a lot of other things that work. They're a little slower, but we can do that. So no one has to do Botox or fillers.
Yeah.
It is a personal choice. And that has to be really emphasized to people because people get scared. Like, do I have to do it? You don't have to do anything in aesthetics.
Yes,
You know, you can
yes.
stay at home and like watch TV and chill out also. It's fine, okay?
Yeah.
It's a choice.
Yes, of course.
Now, regarding Botox, I'm not a particular fan of preventative Botox, meaning I don't believe in starting early per se. I don't think girls in their 20s should start Botox just to prevent lines from coming. If you have lines and they bother you, by all means do Botox.
Yeah.
It's no harm. We've studied it for like decades and decades, very safe. We know how to use it. Works, really easy to fix in case you have a problem. It's fine.
Yeah.
When it comes to fillers again are for specific things. Hollows, under eye hollows, they're really hard.
Yeah.
Young girls, you know, not even young girls, women that are getting married, they have that hollow, tough to cover with makeup. I work a lot with makeup artists. Patients are like, I need this gone like by next month. Best option, filler. You want your lips a little plumper, very natural. I love a natural lip. I hate duck lip. I don't know who created that. It's disgusting. You want a little boost. You want a little plumpness. We do beautiful natural work that looks nice.
Yeah.
You want some structure in your jaw. I have a lot of people in TV or in movies or on screen, you know, that light reflex. You know, their director has a specific requirement. I get it. You know, it happens. We spend a lot of time on Instagram. That visual, it's fine. It's safe. Again, decades of study.
Yeah.
They're fine.
Yeah.
It is when you overdo things and don't do it logically.
Yeah.
It is when you decide I have to freeze my face when you don't need to. It's when you decide that I cannot handle even a little bit of line, so you pump your face with filler.
Yeah.
That's where the problems come. I don't like overfilled faces, and most decent practitioners, most decent doctors don't want to do that. Your aesthetic should align with your doctor. Like I have done everything.
Yeah.
But I don't think anyone should be able to tell.
And your face should not change it either, because what happens, like if you go overboard, you start looking like somebody else, right?
So I agree with you. So I don't believe in that like weird ageless look that you look, you can't tell how old you are and you just look like a Stepford wife.
Yes.
That's not ethic. That's not pretty.
Yeah.
I love the variation of each human face. You know, every face has such charm, such beauty. I love their dimples. I love, you know, their facial structure. It's just to highlight or just to augment it a bit. You know, there's such beautiful lips in India, all different shapes. When people come to me with like Kylie Jenner's lip, I'm like, you don't want that. You want your lip. Let's just enhance it a bit.
Yeah.
It's about you, but just being like doing that little extra jump, that little tweak.
Yeah.
That's pretty because you're still you. You should never look in the mirror and not be able to recognize yourself.
Absolutely. Totally agree with you there. But things like your smile lines, for example, or your lips, they start to droop a little. I think those become a bit of a concern with age. Is there any way that you can fix those without any fillers?
Oh, for sure. We do great lifting technologies. Althera is wonderful. I've been doing Althera for so long. You know, again, 10 years. My God, I'm so old. Okay, so
I'm beautiful.
Thank you. 10 years we've been doing Althera. Great results, great lifting, no needles. Then there's things like Maatehood, where we can even structure and sculpt the face the way we want it, which is a type of HIFU. Really nice, pretty comfortable, great results. Double chin reduction. I do a lot of both Althera and Maatehood. And I really like to work on my jawline.
Yeah.
I mean, just such beautiful things we have. We do V-Face, which is for muscle tone. So people that are less saggy, we can actually strengthen the muscle, which is so organic, so natural.
And this is more natural, no side effects kind of
super
treatment.
Great. Yeah, you're just exercising
nothing is
the
injected
face.
in your skin.
No injections. You're just exercising your face, but hyper-powered, right?
Yeah.
So you're getting a beautiful response, and we see that face shape just turn back into what it should have been.
Yeah.
There's such great stuff out there. I love technology. It's so exciting. The beautiful work we can do for people. And we can work with what they want. Don't want injections? Here we have another option.
Yeah.
You want injections? You're in a rush? Here we have this option. But does our aesthetic align? Does our style align? So much is about taste.
Absolutely. So if you had to give a mom a 3-step non-negotiable skincare routine, what would that be?
Cleanse, moisturize, sunblock. Busy moms, I know it's really tough. So you choose one part of the day that you can do your skincare. I need 4 minutes from you, and that's it. You can cleanse. You can use a nice topical vitamin C for antioxidant protection. If vitamin C doesn't suit you, you're getting zits, you can use resveratrol. If you're getting too many zits, you can use a pore refiner. Then a moisturizer. and finally a sunblock. These are the 4 things I need you to do. I'm sorry, it's more than 3 steps, but do it at least once a day.
All right.
If you can't do your night routine, use a face wipe, apply moisturizer, go to bed. But 4 minutes, you can do it. It's just for you.
Absolutely. And while selecting the sunscreens, I think there's so many different theories now. It should be all mineral based, chemical based, or should not be used very frequently, should be used very frequently. So it can be very confusing. How should one choose their sunscreen? That is number 1. And should they be using it while they're inside the house? How frequently they should be using it? Please tell me.
So sunblock is required data-wise to be 2 milligrams per centimeter squared. That accounts for about 2 spoons for your face and neck.
Teaspoon?
Teaspoons, sure. Okay. But understand that sunblock loses its efficacy over time.
Yes.
So every 3 to 4 hours is when you want to apply. Some people say 2, I say 3 to 4 hours. Let's be logical. Yes, you do use it indoors or outdoors. Why indoors? Because you're still getting ambient light from your windows.
Yeah.
Visible light also has an effect on your skin. So usually you want something with a bit of a tint so it has iron oxide to cover those visible lights.
Yes.
I prefer mineral sunblocks over chemical sunscreens. They don't show any evidence of entering into your bloodstream, whereas chemical sunscreens have certain sunblock ingredients have been shown to enter into your bloodstream. What they do in your bloodstream, we don't know.
Yeah.
But they are in there, and why have it if you can avoid it?
Yeah.
That being said, if you have a history of skin cancer, you have a family history of skin cancer, tendency towards skin cancer, you have tendency towards terrible pigmentation bothers you, whatever sunscreen you'll apply is better than not applying sunscreen at all, okay? If you can't handle the white cast, you can use mixed chemical and mineral sunblock agents. The European sunblock agents are very nice.
Yeah.
Korean sunblock agents are also quite nice. So you don't have to stick to your oxybenzones. You can have alternative agents, but sunblock over no sunblock for sure.
How about sunblocks which are driven from natural ingredients?
Natural ingredients like what?
Like some brands, they claim to have natural ingredients, and I would say not 100%, but 98-99% ingredients which are used as source of the sunblock is all natural.
So natural, I mean, would also mean mineral sunblocks. Minerals are natural. They are mined from the earth or from sand. So that would be natural. So your mineral sunblocks are technically natural. The other natural ingredients, certain oils, carrots, all those things have a certain benefit. You want to check your SPF with it, and you want a third-party SPF testing because the company might say whatever they want and the factory will say whatever they want. But a third-party SPF testing is vital to know, is it actually happening? Are you actually getting that protection? If you apply it, will you be protected from sun damage for more than 30 minutes? Okay?
Yeah.
And that's very important. We can't just trust what the company says.
And what is the ideal SPF on day-to-day basis?
To me, it's between SPF 30 and 50. Anything more than that, you're just getting an extra 1% benefit, but a lot more oil, because most of these chemical agents are oil soluble and it's very uncomfortable.
Okay. And does SPF have anything to do with the duration it will be effective for?
No.
No.
SPF does not.
Okay. It's just the protection factor, like how much it is covering.
Yes.
All right.
So
great.
98% versus 97% of UVB protection.
Okay, good to know. Now, jumping into children's skincare.
Ooh, best topic.
My favorite topic. And of course, being founder of Maate, I think it's just very close to my heart. And there are always so many questions parents have around children's skincare. Before I have my questions, I would love to know what are the most common concerns that you hear from parents?
The most common concerns are dry skin, which really is very well manageable by gentle, like oil-based body washes or gentle cleansing agents. Nothing with too much foam, really keep it clean. Great heavy emollient-based moisturizers and humectants. Fragrance-free, color-free. I like it as clean as possible.
Sure.
And sometimes oils work, but some kids don't tolerate oils very well.
Yeah.
They actually get rashes, so then we avoid oils. But usually it's dry skin and eczema.
Yeah. Eczema is, of course, one of the very worrying concern for parents, and they also often do not know how to handle that. So, and sometimes babies are born with eczema. So, how do you suggest that they should handle this, and what are the things they should be very mindful of?
So it's really important to be very data-centric here. If you have a tendency towards dry skin, family history of eczema, you have a history of eczema, your kid has a history of eczema, asthma, any of these things, allergic rhinitis, they all travel together. You want to moisturize as much as possible. You want to avoid hot showers. You want to avoid long baths. You want healthy fats in the diet. Like I said, oil-based cleansers for the body, and great moisturization twice a day. And then you want to do a barrier agent. So the barrier agent can be a pure oil, not one with essential oils, but a pure oil. If oil doesn't tolerate, it can be a petrolatum jelly. Sometimes even butters can help.
Yeah.
But the strongest barrier is petrolatum jelly because it has 100% protection against transepidermal water loss. So if your skin naturally gets rid of water faster than other people's skin, which is eczema, then you want anything that'll stop that water from leaving.
Yeah. Yeah. And sometimes it can get really worse, it can be a SOS situation. So what are the things parents should do in that case?
So when it's really bad, honestly, medication is required. So you'll have to go to a doctor. You'll have to be prescribed medication. There are wonderful medications out there that are not topical steroids, although sometimes you do need a short course of it. There are a bunch of things out now that we do that are not steroid-based that really help treat and prevent eczema. I have many patients of mine, young kids and my teens, that are using great agents to prevent their eczema, kids who have a tendency towards eczema that don't use topical steroids. So that whole I don't want to put steroids on my kid fear is managed in the modern world. We have great stuff.
True. If I talk about, again, coming back to the natural sciences and Ayurveda, they say that all these diseases, when it comes to any sort of autoimmune or eczema, which is, again, I think one of the autoimmunes, the only way to handle or deal with it is to have your gut completely detoxed and fix your gut health.
So look, having your gut health improve is great, but that's not everything at all. Eczema is actually is genetic.
Yeah.
So you have a genetic defect. I don't know how gut health will help with a filaggrin issue, right? This won't work. Dry skin, it can be a sign of certain gut issues, but which gut issue?
Yeah.
So it's too generic. This whole kind of fix your gut and everything will solve. That's just not true. It's not possible.
Because gut health is, again, another obsession which I see all around, and you have to start your day with these seeds, those seeds, and I think throughout the day you have to follow such strict lifestyle and routine that it becomes really very overwhelming for anybody. And do we really need that?
No, it's too simplistic also. Fix your gut health, everything will go away. That's ridiculous, right? Who decides what gut health is anyway?
Yeah.
What does that even mean? Yeah. What microbiome are you looking for? Are you doing stool tests to assess the microbiome? Are you looking at your microbiotica, the genes that are in your gut? What are you looking at?
Yeah.
Is it just how you feel? Then that can be anything.
Or it could be just one of the marketing gimmick from all these new brands which are coming in the market, right? Eat this or drink that. And I think that is the whole thing which is going around. Now, coming to the skincare routine for children.
Yes.
What are your recommendations?
Honestly, I just did the interview for India today on the same thing. They asked me the same question. And it was just gentle cleansing, great moisturizer, sunblock above the age of 5.
Yeah.
Mineral sunblock. That's it. Kids need nothing else. And the sunblock, honestly, only when they're outdoors. They're just not as sensitive indoors.
Yeah.
When they're indoors, it's fine. I don't see any major reason to worry about visible light. They don't have pigmentation issues.
Yeah.
They're okay. But when they're outdoors, when they're swimming, be very careful with sunblock and with moisturization.
I'll come to that, but first the cleansing part of it. We really emphasize that, especially at Maate also, we emphasize that all the cleansers should be pH balanced for children. How true you think that is and how important it is?
Absolutely. I mean, a pH balanced cleanser makes a big difference. It less irritating, less drying, more basic agents like soaps. Soaps tend to be basic.
Yeah.
They leach the skin of moisture. We don't want that.
Yeah.
More acidic can make it a little bit more irritated. We don't want that either. So pH balance is important. Absolutely. Most cleansers are pH balanced for kids, I hope.
Not most, but yes, now.
Okay.
There's a whole awakening around that. So before you make the decision of using any certain product for your children, what are the things you should really look for and you should completely avoid?
So I look for emollients, what kind of emollients do they have? I look for occlusive agents. I look for humectants like glycerin, so, agents like that. Essential fatty acids, ceramides for eczema-prone skin.
Yeah.
These are very important for me. Healthy fats, which are essential fatty acids. This is important for me. Things that I do not like. I do not like fragrance.
Yes.
I do not like color. I like to avoid lanolin. Some kids really are sensitive to lanolin, which is wool alcohol. These are the biggies, yeah.
Yeah, phthalates and mineral oils, these are the most basic ones we have to completely avoid. Do you have any favorite ingredients that children products should definitely have?
Not really. It really is how effective it is
Yeah.
at holding water in the skin. To me, it's all about holding water in the skin.
Yeah.
That's what I care about.
And I like that you use the word effective, because recently we've been doing this campaign where we say that just having gentle and pure is not enough. You also have to ensure that the products are effective enough.
Yeah, absolutely.
So, because I think for so long when it comes to babies' products, these words gentle and pure have been there in the market, and these have become the thing to look for. But I think it goes beyond that.
Yeah.
Because children are also now born with so many issues and concerns, and we have to set the foundation right.
Absolutely.
What are your thoughts around some parents end up using their own products for children?
Oh, no, please don't do that.
Yeah.
Your own products are not going to suit your children. Your kids actually have much more permeable skin. So stuff penetrates in much more in a kid's skin than in an adult skin. So they're more sensitive. They can get more irritated. That fragrance can absorb more than on you. I would not use your own products on them.
No.
Use products that are tested on children, proven for children.
Yeah.
And use, honestly, the most moisturization you can give them is the better.
True. Totally agree with that. I'm like big fan of butters, especially. Just want to moisturize them and massage them with butters, because it's not sticky, and at the same time it's highly moisturizing, deeply hydrating.
I think massage is wonderful for children.
Yeah.
You know, one, it's so nourishing. It helps them with their growing pains.
Yes.
It helps with so many different tone of the skin. It helps with so many things. And kids love it. My daughter loves being massaged.
Same. My son is a big fan of that. And I love it too. I mean, it's just such a beautiful bonding time.
Yeah, she
So
loves it. She loves when I
amazing.
massage her legs.
Yeah.
She's like, Mama, do more. She loves it.
Wow. Now, coming to sunscreen for children, you just mentioned that we should not be using that indoor. Outdoor is sufficient. But should we be using sunscreen for children every day? Because a lot of parents just pick sunscreens when they're on holidays or by the beach. Those are the only times we use sunscreen, but not on day-to-day basis.
I think every day if you're going outdoors every day, use it.
Yeah.
I don't see any harm in it. You're using a mineral sunblock. My daughter uses 100% mineral sunblock, and she looks like a ghost, but she's fine with it. She's absolutely fine with it.
Yeah.
And all children will develop their own assessment. There's different sunblocks out there, and that's fine. I would use it every day no matter what.
Yeah.
And when you're on the beach or out swimming, use it even more. Reapply even more.
True.
Because that stuff goes away really fast. And remember, you have cumulative sun damage over the years. What you're damaging the skin as you're younger, it is going to show up even 10 or 20 years later.
Yeah. And I think there's also this, I would say, misconception that sunscreen is just to prevent tanning.
Yeah, that's not true.
That's not true.
So tan, people think like a tan, right? They're
Yeah.
like, oh, I look nice. Like I used to love being tanned, especially coming from the US. But a tan is a sign of damage. It means that your skin is damaged. So your cells are releasing melanin in response to protect against further damage. You have definitely damaged your skin if you get tanned.
Yeah.
We don't even understand that. The other thing that you're looking at, what else happens? You get cumulative pigmentation, you get oxidative stress, enlarged pores, early wrinkles. That's all aesthetic. But the reality is that's also showing signs of cumulative DNA damage. You have field DNA damage of that entire area that's exposed. That gets worse and worse over time. That DNA damage is not good, right? All those like weird freckles that you see on over sun exposed areas, that's all DNA damage.
Yeah. So parents, do not think that sunblock or sunscreen is just to prevent tanning, but it is actually prevent your children's skin from any sort of damage, and just have a beautiful foundation in the early days and early years, I would say.
Yeah. And kids are more and more concerned nowadays.
True.
So simple things now will make them feel better even 10 years from now.
Yeah, 100%. But tanning usually happen very easily among children compared to adults. Why do you think that happens?
I think that, see, adults aren't out in the sun like for 4 hours at a time playing soccer.
Yeah,
right?
yeah.
Kids are outdoors, they're swimming, they're playing, they don't care about what they look like, they're not stressed about it, they're having the time of their life. And I love that for them. Like my daughter spent the whole summer swimming. She swam 4 or 5 hours a day. She was just in the pool with her cousins.
Yeah.
Did she get tan? Sure. Did I do as much sunblock as I could? Absolutely. But it can't cover for all of it, right? You're in a pool for 5 hours. Can I stop her from tanning? No. I can prevent some, but not all. That's really it. I think it's just so much exposure.
True.
The other thing is I need more data on this, to be very honest. I do believe the oral antioxidants in our diet is reducing. That also makes a difference. And honestly, the fruits and vegetables we have now are 60% less nutritious than they used to be. And I talk about that in my book, actually.
Yeah.
So the food we're eating is less nutritious. Then we're not eating the things that we should eat.
Yeah.
And that also has an impact. I have seen kids who tan very easily, and I give them a juice recipe. It's called 7 Juice recipe. And it's in my book as well.
Yeah.
And it really makes a difference because their internal antioxidant status is so much more after that. They hate the juice, but they're like, fine, mom made me drink it.
Yeah.
But it tastes good, so they don't mind at the end of it. And their skin is genuinely better.
I'm sure. But we get this question a lot from parents, and like they've been on a holiday, just came back, and children are completely tanned. Do we have any product for detanning, for example?
The skin will detan on its own.
Yeah.
Give it 30 to 60 days.
Absolutely. But then they'll tan again. Which is also, again, all natural and beautiful to see, because that means children are really enjoying, as you said, and they're out and about and outdoor.
Let them have
playing, having fun. So it's a sign of that, I would say.
There's a balance, right?
Yeah.
We can't only care about the tan. We have to balance in the good with the bad.
Yeah.
Can I 100% prevent a tan if my child is going to play outdoors all day? No. But is she going to have the time of her life? Yes. Absolutely.
Yeah. But just for the sake of, right knowledge out there, should they be using any detan products?
I don't think so. Ultimately, detan products typically rely on scrubs. It can be irritating and drying for kids. A lot of people use milk or they use uktan. It can irritate and dry your kid's skin. Your skin will naturally turn over. In kids, it turns over in 30 days. I just give 60 days in case it's a deeper tan.
Yeah.
So it naturally will turn over and those damaged skins will go.
And I have got this very special book from you, Dr. Skin Sense. I have received a copy of it in the past and I loved the book.
Thank you.
But if you could tell our viewers what is the secret ingredient in here and the secret tips that they can find out about skincare.
So my book talks about, basically it's like a deep dive and easy to read way to know all about what to do for your skin, what to do for your hair, what to do with your diet, how to handle PCOS, and all the crazy treatments that are out there, how to navigate it. And I wrote it in a way that anybody can understand it. So if you want a good foundation of skin and science and hair and diet and hormones, it's got it all. And it also talks about grandma's remedies and which ones work and which ones don't.
Talking about that, there are a lot of times we think that the natural remedies or homemade recipes are far better than what is available in the market. Do you think those are equally effective?
No. I'm a science girl, okay? Some of those home remedies are nice, and I talk about that as well.
Yes.
But the reality is science takes the active ingredient from that home remedy and hyperpowers it.
Yes.
So I'm an impatient human, and I want results now. I don't feel like waiting 7 years. Like, that's a long time. I'm really uninterested in that. I want to see it as fast as possible.
I completely
So I love
understand
science.
what you mean. And I think that is also one of the philosophies we have at Maate, that we combine traditional practices with modern science to make it much more effective and much more powerful, as you rightly said. All right, last question for today, since we're talking about children's skincare, and I think it gets really tricky when children enter puberty, early teens or teenage, the acne.
Yes.
And it can be very stressful for parents to deal with those. What are your tips, the complete no-nos that parents should avoid when it comes to their children's preteen acne?
Okay, so definite no-nos. I know parents love dairy, but cut out their dairy. You will get calcium from spinach, a bunch of different sources. You don't need dairy for it. They can still have yogurt. It's okay. But cut their dairy. It'll make a big difference. In that age, they already have so much hormonal change. Their testosterone, everything is changing. So dairy will worsen that situation very often. And 30% of acne is actually caused by dairy. So you cut it out, feel better.
Yeah.
The second thing is don't let your kid pick their acne.
Yeah.
I see so many kids and their acne, like I treat it and their acne is going away, but they're still picking at everything and they're causing so many scars.
Yeah.
The scars are so much harder to treat. Don't let them pick their acne. The third thing is don't let your parents or your grandparents give them weird home remedies. A lot of the time it just makes everything worse. And the final thing I would say is treat it early before it gets bad.
Yeah.
Because you don't want them to have scars. Scars are really hard for kids to handle. And at
Yeah.
that age, honestly, every issue is so much more magnified for them emotionally.
Yeah.
They can't put it into perspective. It's just how their brains are developing.
Yeah.
Children's brains develop in a way where everything is larger than maybe it is in reality. They may have a few pimples, but to them it's the world has ended.
Yeah.
And that's biologically and neurochemically normal.
Yeah, absolutely. And when is the right time that parents should realize that this is now the time that my acne needs to be looked at by a professional or a doctor?
So I actually tell them if they start when the kids already have blackheads and whiteheads, just early, you can just give them gentle skincare, nothing even medicated.
Yeah.
And that'll help prevent quite a bit. So when you start seeing those blackheads and whiteheads, take them to a doctor, get a gentle routine, nothing too harsh, start it now. Because if it gets worse, again, it's harder for kids to treat, and kids don't have patience.
Yeah.
They can't wait that 6 months for the acne to go.
Yeah.
They really don't. They don't want to.
True. That is the hair care. And so when we talk about hair care, the hair growth serums are getting very popular. So the ingredients like rosemary, anagen, and some of the other very popular ingredients which claim to help you with hair growth and hair density, is till what extent it's true?
So there was a decent study, although it's not a huge study, that says that rosemary can have benefit. So I personally find pure rosemary extract to be beneficial.
Yeah.
Onion works only in alopecia areata, so those round patches. Not been shown for regular hair fall, so I'm not a big fan of onion. Although clearly there are many places where onion is people are obsessed with.
Yeah.
Peptides are wonderful. I do think that they help. They can help. Again, my issue with a lot of this stuff is nobody looks at the fundamental cause. Are you balding because your dad was balding? Right?
Yeah.
Then maybe like that onion is definitely not going to work for you, right?
Yeah.
But are you just losing hair because you just had a baby? Maybe you just need vitamins and good hair care.
True.
So
Supplementation.
So the question really is, what's the cause of your hair fall? And then we treat. I don't like this like treat and go backwards thing.
Yeah.
I don't like mediocre work.
Yeah.
I want to optimize. I'm an optimizer. I want to optimize every single thing I do. If you have hair fall, I want to know why. And then I want to give the exact targeted treatment that will give you the best result. I don't want to just guess.
Yeah.
Right? And when you're just trying a peptide, you're trying rosemary, and you're not identifying why you're having the problem, you're just guessing. A guess is a 50-50 shot.
Yeah.
Even then, it's probably less than 50-50 because there's so many other options. So you're picking 1 out of 10. So you have a 10% shot of having a benefit.
Yeah.
And the other thing I don't like is when people have low expectations. People will start like a niacinamide or a product and be like, my acne's better, so I'm fine.
Yeah.
But they still have grade 2, grade 3 acne. But they're like, oh, I'm not having grade 4 acne.
It's not that worse anymore.
It's not that bad anymore. So I'm on the right track and I'm
Yeah.
fine. But they'll stay there. Nothing will change, but it's better.
Yeah.
Why is your expectation that?
Yeah.
Your expectation is wrong in that case, right? If we can cure acne or improve acne,
Yeah.
you may have recurrent acne that's separate, and I can get you down to 0 to 1 pimple a month.
Yeah.
Isn't that the goal?
Yeah.
Right? Why is it like, oh, it's better, I'm fine? Maybe your goal is wrong.
True. Now, using peptides to treat hair thinning and hair fall, I think it is one of the most recent trends. How effective do you think that is?
Peptides have been around for ages.
Yeah.
Ages. It's just that now everyone is on social media and wants to market to you, so you think it's new.
Yeah.
It ain't new. It's
Yeah.
around. They help, okay? Are they
Okay.
the #1 treatment for hair fall? No. Are they a great adjunct? Is it something we can add? Absolutely.
And how should one use that?
Typically, it's 1 to 2 a day, depending on which peptides you're using, which product you're using, which brand
Yeah.
you're using,
Yeah.
and what the objective is.
I think we're going to get a lot of questions like which brand to pick.
No, that I can't say.
Thank you so much for being on Maatehood. It's been such an insightful conversation.
Thank you.
I just have one last game to play
Uh-huh.
before we wrap it up, and just a bit of fun. And before that, one community Q&A. So So our listener from Riddhi asked, I use the same body wash for my toddler and myself. Is that a big no?
It's a big no. Your body wash is going to be very different than your kid's body wash unless you're using a specific body wash for eczema that's proven safe for children. Don't use it on your kid. Use a product for your kid for your kid.
But what she means is she's using the baby's body wash on herself.
Oh, that's what she means.
Yeah.
It depends on, again, everything depends on what the body wash is, and what her concern is. If she has dry skin, you use an oil-based wash.
Yeah.
That's the best way to go. Or a cream cleanser. Just use what's right for your skin. What is all this need for hacking and what is it?
Yeah.
Use what's right for your skin.
Yeah, what's meant for you, formulated for you. All right, so the game segment, and today it's called Glow or No. And it's like a rapid fire basically, and I'm gonna ask you a bunch of questions, if popular skincare trends and products, some hacks, and all you have to do is tell us if they give a real glow or a big fat no, basically. So it's just one line.
Okay.
Ready? Sheet mask.
Big fat no.
I thought you were gonna say glow.
No, unless you use exosome-based sheet
Yeah.
masks or like really heavy moisturization ones, then it's a temporary glow, but it's not a long-term glow. So it's a more complex question. But
Yeah.
so I'm going to say for now, big fat no, but really it's more complex than that.
All right. Ice facials.
Good for, what is the answer? What does it say?
Glow or big fat no?
Glow.
Glow. All right. DIY lemon honey scrub.
Big fat no.
Baby oil for makeup removal.
Big fat no.
Collagen gummies.
Depends. If it's 3 grams of collagen in the gummy, it's fine. But usually the gummies can't handle that much weight.
Yeah. Ayurvedic ghee massage for kids.
Try it. If it suits them, why not?
Sunscreen only when it's sunny.
No, it depends on the UV index. So big fat no.
Skipping moisturizer if you have oily skin.
Glow.
Oh, is it?
Yeah.
Okay. Using talc-free baby powder.
Glow.
Drinking 10 glasses of water equals glowing skin.
It doesn't equal glowing skin, but it's good for you.
Well, it was fun playing the game with you. And since you played it so well, you deserve a hamper.
Ooh.
So, Dr. Kiran, here's your prize for winning
Thank
our game from Maate.